Imagine going to bed perfectly fine but waking up unable to move your arm, speak clearly or even walk without stumbling. No warning, no pain, just a stroke overnight. And the shocking part, it might not be from junk food, smoking, or lack of exercise. It could be from something you thought was helping your health. A supplement sitting on your nightstand. The truth is, vitamins aren't good or bad on their own. It's how you take them that matters. As we get older, our bodies process nutrients differently. Seniors often take multiple medications, have higher blood pressure or existing artery problems, factors that can turn a so-called safe vitamin into a dangerous trigger for stroke or heart disease. In this video, I'll reveal 5 vitamins mistakes that could quietly damage your heart, brain, and raise your risk of becoming paralyzed overnight. If you, or someone you love, take daily vitamins, this video could be the most important 10 minutes of your week. And don't forget to subscribe to Health Formula for more science-backed health tips. Let's get started. 1. Vitamin B6. Vitamin B6, also called pyridoxine, is often praised as a brain vitamin. It helps your body make neurotransmitters like serotonin and dopamine, supports red blood cell production, and even helps keep homocysteine levels in check. But here's what most people don't realize. Too much vitamin B6 can quietly damage your nervous system and increase your risk of stroke. Unlike other water-soluble vitamins, which your body flushes out easily, vitamin B6 can build up in your tissues if you take high doses over long periods of time. Excess B6 in the body leads to something called pyridoxine neurotoxicity. That means nerve damage, causing tingling, numbness, burning sensations, poor balance, and muscle weakness. These problems don't just mimic stroke symptoms, they actually make the brain and blood vessels more vulnerable to stroke events. Several studies back this up. A clinical review in Stat Pearls, 2023, found that vitamin B6 doses of 200 milligrams per day or more can cause permanent nerve damage. More recently, the European Food Safety Authority, 2023, lowered the upper safe limit to just 12 milligrams per day, because cases of neuropathy have been reported at doses as low as 50 milligrams daily with long-term use. And while B6 is supposed to lower homocysteine, too much can actually disrupt B vitamin balance, allowing homocysteine to rise again, a known risk factor for ischemic stroke. So how do you protect your brain without tipping into danger? The key is moderation. Most adults only need 1.5 to 2 milligrams daily, which is easily met through a balanced diet. Poultry, bananas, fish, and potatoes are all rich natural sources. 2. Vitamin A. While praised for its role in vision, immunity, and skin health, vitamin A is also one of the most overlooked sources of nutrient overload, and surprisingly, a hidden contributor to stroke risk in older adults. You see, vitamin A is a fat-soluble vitamin, which means your body stores it in the liver and fat tissue instead of flushing it out in urine like vitamin C. That storage becomes a problem when levels build up over time. Too much vitamin A, known as hypervitaminosis A, can increase pressure inside the skull, called intracranial hypertension, and disrupt the balance of clotting factors, making blood vessels more fragile. Over time, this can stiffen and weaken arteries, increasing the chances of both hemorrhagic and ischemic stroke. Research backs this up. Case studies in stroke and the American Journal of Clinical Nutrition describe patients who developed stroke-like symptoms after taking long-term high doses of vitamin A, sometimes just 25,000 to 50,000 IU per day. A meta-analysis published in Annals of Internal Medicine also found that people who consistently consumed high amounts of retinol, the active form of vitamin A, had higher risks of vascular complications and bone fractures. On the other hand, beta-carotene, the plant form of vitamin A found in carrots, sweet potatoes, and leafy greens, doesn't carry the same risk. Why? Because your body only converts beta-carotene into vitamin A when it needs it, creating a natural safety valve. So the safest way forward is, most adults should avoid high-dose vitamin A supplements unless prescribed by a doctor for deficiency. Getting vitamin A mainly from colorful fruits and vegetables is safer, since your body regulates the conversion. And if you do take a supplement, always check the label. Stick with moderate doses and avoid megadoses of preformed vitamin A, retinol. 3. Vitamin D. I know you might think, isn't vitamin D supposed to be good for you? And yes, you're right. Vitamin D is vital for bones, immunity, mood, and even brain health. Vitamin D itself is never a problem. The problem is when you take high doses like 10,000 IU daily or those massive weekly megadoses. What happened then? Your vitamin D blood levels can climb into toxic range, and this makes your body starts absorbing way too much calcium from your diet, leading to hypercalcemia, which means excess calcium floating in your bloodstream. And calcium doesn't just stay in the blood, It can easily get deposited in the wrong places, like inside your arteries, causing vascular calcification and stiff, narrow blood vessels. Over time, this directly translates into higher blood pressure and reduced flexibility of arteries, and suddenly you have the perfect setup for a clot. One clot in the wrong place overnight, that's a stroke. Here's where research adds weight. Cynical reviews caution that routine megadoses of vitamin D, especially without monitoring, increase risks when combined with calcium or heart medications. So the smarter way is to not just copy the crowd popping multiple capsules. Rather, get your vitamin D blood levels checked first. If you're deficient, a safe range, like 3,000–5,000 IU daily is enough. Higher doses should only be under medical supervision, and pair it wisely with vitamin K2, especially MK7. And don't forget the simplest, safest source, sunlight. Just 10–20 minutes outdoors can make a huge difference, and your body self-regulates production so you can't overdose from the sun. 4. Vitamin E. Many people over 60 add vitamin E to their routine, hoping it'll support their heart, improve circulation, maybe even boost memory and skin health. But here's the part that doesn't make it onto the bottle label. Vitamin E, especially in the wrong form, can increase your risk of bleeding in the brain. A 2010 meta-analysis showed vitamin E supplements reduced ischemic stroke risk by about 10%, but increased hemorrhagic stroke risk by 22%, which is bleeding inside the brain. And the science is clear. Vitamin E works like a natural anticoagulant, meaning it has blood-thinning effect. The problem rises when you take high doses of vitamin E, especially synthetic one made from petrochemical derivatives like DL-alpha tocopherol. This form is less bioavailable and your body doesn't absorb it effectively. The risk rises if you're already on aspirin, Plavix, or any blood thinner, and then add vitamin E. Your internal bleeding quietly goes up, especially in the brain, where even a small bleed can steal your speech, your memory, or your ability to walk. And get this, the recommended daily intake for older adults is just 15 milligrams, about 22 IU, yet most supplements on store shelves contain 200, 400, even 1,000 IU per capsule. No warnings, no consultations, and many folks take them every day for years. This is why getting your vitamin E from natural, food-based sources is far superior to relying on cheap synthetic supplements. Whole foods such as red palm oil, sunflower seeds, almonds, hazelnuts, and avocado deliver a complete spectrum of vitamin E compounds called tocotrienols in the right balance, just as your body is designed to recognize, absorb, and use them efficiently. 5. Iron. Your body needs iron to make hemoglobin, carry oxygen in the blood, and support energy production. But the problem is, unlike some nutrients, the body has no efficient way to get rid of excess iron. When levels build up, iron begins to act as a pro-oxidant, meaning it fuels the production of harmful free radicals. These free radicals damage the lining of blood vessels, promote inflammation, and accelerate the formation of arterial plaque. Over time, this makes the arteries stiffer and narrower, raising blood pressure and making it far more likely for a clot to form and block blood flow to the brain, a recipe for stroke. Research supports these concerns. A large-scale study published in Stroke, American Heart Association Journal, found that people with higher iron stores measured by serum ferritin levels had a significantly increased risk of ischemic stroke. Another study in the Journal of Neurology, Neurosurgery, and Psychiatry reported that elevated body iron may contribute to greater brain injury after a stroke, worsening outcomes. Even moderate iron overload, common in seniors due to reduced regulation with age or frequent supplementation, has been associated with higher risks of both cardiovascular disease and cerebrovascular events. So, how do you keep your iron in the healthy range without tipping into overload? First, avoid unnecessary supplementation. Most seniors don't need extra iron unless diagnosed with anemia by a doctor. Second, monitor iron levels with blood tests like ferritin and transferrin saturation, especially if you're taking multivitamins that contain iron. And third, aim to get iron primarily from food sources like lean meats, beans, lentils, pumpkin seeds, and leafy greens, where it comes packaged with other nutrients that help regulate absorption. Your body at 60, 70, or 80 doesn't work the way it did decades ago. What once seemed harmless can now have unintended consequences if taken the wrong way. That's why staying informed is more powerful than any capsule or bottle on your shelf. You don't need to fear supplements, but you should respect them. Read labels carefully, ask questions, and pay attention to the signals your body sends, even the quiet ones. Awareness and balance are what truly keep you strong. And as always, remember, this video is for educational purposes only. It's not medical advice. For personal health decisions, always consult with a qualified healthcare professional. If this video gave you clarity, don't forget to hit the like button and subscribe for more science-backed health insights. Thanks for watching. See you in the next one.